a board certified orthodontist is a very heavy lift, heavy and hard as well. Tell us what would you say is what was the hardest part about this process for you?
So I'm a non-traditional applicant, student. I've been out of school for about 13 years now. So just applying was the hardest part, having to get my mindset into student. I am now a student has been the hardest thing. I haven't been in a formal dental setting in 13 years. That whole application process, I mean, it was behind me, or so I thought, until things changed in my life and I had to apply.
Orthodontics. Yes, the mystery of the black box and what's inside. And not everyone has access to that information. But if you apply to ortho and get in, like today's guest, you get to open up the black box and all the goodies that are there. So stay tuned as we talk to a recently matched incoming ortho resident, and she's going to tell you everything about the process and how she did it. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and life as a new dentist. Guys, be sure that you are continuing to share, to comment, what else? To subscribe and also support the channel. We have close to 500 videos that have been designed to help you through this journey called becoming a dentist. So be sure to support us, to continue to support us, and share the channel and the episodes with people that you know that could benefit from some of the information. Also, today's episode is being brought to you by getintodentalresidency.com. Yep, right down here. Getintodentalresidency.com, the ultimate resource to help you get into and prepare yourself with your application, your interview, and other things to help you get into the residency program of your dreams. For more details, go to the link down below. All right, special guest who is going to be a board certified orthodontist. This is a dream that's been deferred only because of time, but it's deferred no more. So today we have Dr. Johnson, who's going to share with us her journey to becoming an orthodontist. First step being getting into ortho residency. Doc, how you doing today?
I'm good. Thanks for having me.
Yes. Well, we know you've been busy, both with your practice, family, and also with this application process, and now getting ready to start ortho. So for those people that are meeting you for the first time, share a little bit about who you are and where you're from, all those details.
Yeah, so as you said, all of the above. My full name is Tinashe Chapfika Johnson. Graduated as Tinashe Chapfika from UConn, but moved to Bermuda to marry my Bermudian husband, and so now I'm Tinashe Chapfika Johnson. I've been in Bermuda for about 8 years now, but before that, I practiced in Connecticut, did my residency at Bronx, Lebanon, dental school at University of Connecticut, undergrad at Cal Poly Pomona, and before that, I was in Zimbabwe and just went to an all-girls school there, very strict, rigid Anglican school, and first got introduced to dentistry by an orthodontist. So, it's a full circle moment.
Full
Truly.
circle.
Yeah, I had braces at 9 and I was like, I love what he's doing. I love his warmth, his character, and just, the surroundings. My mother did mission work, all of that just pretty much ignited the flame for dentistry. And that's what I thought it would be. And alas, a whole XYZ years later that we might mention at the end of this, I am going back to school. So yeah,
to become a board certified orthodontist, right?
To be a board certified orthodontist.
So speaking of such, why ortho? Why did you decide ortho? Because I know you said for dentistry, the ignition was, your dental treatment
Yeah.
when you were younger.
Yeah.
And then that got you into dentistry. But now
Yeah.
focusing on a specialty area where you're going to be the expert
Yeah.
about those braces that you had right when you were younger. So why ortho for you?
Oh, I mean, it's quite hilarious though, right? So it was an orthodontist that got me interested in dentistry. And I don't want to say I had settled to just general dentistry, but all through dental school and residency, I never really even imagined specializing. Yeah, I thought about it. I thought about perio. I thought about oral surgery, but never did orthodontics come up, even though it was an orthodontist that got me interested in dentistry as a whole. So, what really was the final trigger, the final push, was having children. So significant years later, right? I'm married, I have 3 children, I'm now living in this beautiful island, and my son has an underbite, or had, because we have since addressed that issue, but he had an underbite, and I was struggling to get help for him on the island. As you know, Bermuda's beautiful, it's a tiny island, about 70,000 average population. And I wanted to do something early. It just made sense to me. Now that I've learned more, I know a little bit better. But 2 to 3 years ago, and I was that stubborn mother, I was like, no, we must do something now. I was prepared to go as far as Brazil to get him into phase 1 interceptive orthodontics, as now I understand it, just to get his underbite sorted out. I was like, my kid is young. I need help now. I couldn't get it. Scoured the internet for dentists who would intercept. But in my literal quest to sort out my son, I found lecturers in the US who were willing to teach general dentists some of this interceptive early treatment in younger children. And, I was like, oh, well, I'm a dentist. I qualify for these courses. I started flying back and forth to Canada, various parts of the US, mainly New York, Miami, just taking courses. Like every month I was gone for like a weekend, a week gone over the course of a year. And by the end of that year, my son's underbite was resolved. And I was like, are you kidding me? This is amazing. Noticed issues in both of my other daughters also had issues. My baby had an open bite. We resolved her issue early. Then my other daughter was snoring. Some orthodontic interception there. There's obviously the controversy between ortho and airway, but now they're coming together more, learned how to resolve them. So I was able to treat my children, and just family and friends were noticing, their breathing changes, the changes in the anatomy, like, oh, your son's looking cuter these days. Oh, he has a nice smile. Oh, your baby's tongue isn't flying forward all the time, Started treating friends, because as a dentist, I was allowed to. And I was like, I'm really enjoying this. I found myself stepping away less and less general dentistry. And one of my mentors on the island, who happens to be an orthodontist, encouraged me to apply. And I'm not going to lie, when I applied, it was kind of like, I'm not going to get in. Let me just apply and see what happens. I was not confident I would match. I was like, who matches at my age? I have 3 children. I'm old.
Right.
I'm not going to match.
Right.
But I'll apply because I love this mentor in particular. I love her. She's like a guardian angel, and I really, really respect her. So I was like, okay, out of just honoring her, let me try and apply. And that's what I did. That's how I found you, because I was like, I need help. I haven't been in school for 13 years. And I applied and I matched.
You gotta be careful what you wish for. You gotta be careful what you wish for. See?
It's been a journey of gratitude, even from the orthodontic mentor. I mean, just her mentorship, helping you with some of the cases that she saw us doing. Like, maybe you shouldn't do that. You need more training to do that kind of case. Just her saving me like heartache with some cases that I shouldn't touch as a general dentist. It's been an amazing journey. And again, just looking back at how I started with an orthodontist who was as equally amazing as the orthodontists I've been meeting, who've become mentors and literally fairy godmothers and fairy godfathers. It's a full circle moment for me. And when I'm doing it, it doesn't even feel like work. It literally feels like what I was born to do. And I don't want to sound cliche, but for me, I'm like, this is what I was supposed to be doing in dentistry. And if anything, I'm kind of frustrated that I didn't know that in dental school. But I also feel that I did have to go through the journey of understanding my general dentistry really well, and then being a parent, because now my level of empathy and understanding for parents who want to understand what's happening with their kids, who want to help their kids, but they don't know how, who want to help their kids, but they can't afford treatment, because that was me. I've been through all those as a parent thing. So I'm like, yeah, this is what I was born to do. I'm so grateful I got in. I think I would have been heartbroken. I would have reapplied. I mean, let's be honest. I would have kept applying until somebody let me in, even at like 60. I would have been like, I'm still coming.
I'm
Because
still going to be somebody's orthodontist.
Somebody's going to let me in.
That's
Yeah,
right. That's
I
right.
really am a non-traditional
Wow.
older.
Wow.
Yeah, I'm
Amazing
double the
story.
age.
Amazing story.
Yeah,
Amazing
it's time.
story.
It's time.
And for those of you that are listening and watching, it's a story, right? Your story is going to be different, but
Yeah,
it's going to be one that you will definitely need to communicate why ortho for you, right?
yeah,
And that's key. So take notes as you're listening, but also take notes as you are continuing to develop your own story
mhm,
as why ortho for you. So you mentioned mentors and
yeah,
people that kind of helped you frame your thoughts and kind of push you in this direction, which is key. Mentorship
it's key.
matters, right? It's very key. And also as it pertains to the application, right? Someone saying, you should apply. No, I think you better apply.
Yeah,
No, aren't you applying? Like
yeah,
starting that. So let's talk a little bit about how you prepared your application after your mentor said you're
yes,
applying, right? No, it's not a question, it's a statement. You're applying. So
yes.
tell us a little bit about how you went through the process of preparing your application.
So two strategic mentors, right? So there was the one in Zimbabwe who's been harassing me since I was in dental school. In his mind, I should have applied straight out of dental school, but I wasn't ready. But each year he'll check in with me. Have you applied yet? Have you applied yet? But because I wasn't seeing him, no pressure. And then now my mentor in Bermuda, same thing. Have you applied? Have you applied? Oh, you should apply to these programs. Oh, you should apply to these programs. Part of the reason why I felt overwhelmed, like I mentioned earlier, I hadn't been in school for a while, and I know that the language and the process had changed significantly from when I had applied, from things like ADSAS and, I think it was ADSAS for me, but I don't think it's ADSAS anymore. Now it's PASS and ADIA. Learning the different fees, learning who to send what to. I had to dig up my dental records and all my grades that I had forgotten about. They're asking for GPA. I'm like, what's GPA? I had to relearn all of that and, just reform relationships from UConn, where I went for school, and be like, hey, it's me. I'm back. I need my records. And so that's when I was like, I need a coach. I need some guidance, because either I'm going to do this by myself and make a hot mess about it and make it more stressful. And again, I have a family, I have a practice. I need help and guidance from someone who does this in their sleep. And I don't like wasting time. I really believe that if somebody can do something better than you, find them and compensate them and get on with it.
Yeah. Yeah.
And in this
Well,
case, I'm like, yeah, I haven't applied to anything like this in now at this point 20 years. So yeah, I scoured you, and I've been following you before from other things. I had watched some of your interviews, just like curiosity, because I like to learn and see what's out there. And so when it was now my opportunity, it's like, oh yeah, Darwin's a coach.
right,
And that's
right.
like five
Me.
YouTube videos. Whereas it's emailed, and I watched a couple of the interviews specifically with orthodontic residents specifically, because I wanted to see if any of them would resonate with like my particular journey. I wanted to make sure that I had a coach who had an understanding about one, like my background. I'm a female of color, I'm international. I went to Bronx, Lebanon. There were like a lot of overlaps, and I liked that because I was like, oh, okay, it's already a familiar space. I had scouted other coaches, but there wasn't enough overlap for me. I felt like it would be like too much starting from scratch. Whereas with you, I was like, well, even though we haven't met, he's kind of already coached people with similar stories, similar backgrounds, similar experiences, the Bronx, Lebanon thing, the SNDA thing. I was like, yeah, let me harass him until he takes me on.
Well, the fact that you sought help is very
Yeah,
key,
yeah,
right? Those of you listening and watching, this is not one of those processes. This is not a process where you want to do it by yourself when you
no,
don't have to. Seek
yeah,
out the help from other students, mentors, coaches, and organizations that are geared and here to help you through this process, right? For more details about getting that help, go to getintodentalresidency.com with a
yep,
lot of resources there. Also another resource that can help you as you are navigating or starting to navigate your application. We have a couple ebooks that'll be helpful as well. And I'm sharing the information because we all need help. The smartest dentist, new dentist, dental student is the one that asks questions and gets help,
yep,
right?
yeah,
So,
I agree. Yeah,
yeah, it's Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you, but you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode. So also go to dentalresidencyhq.com, dentalresidencyhq.com for some more resources. You mentioned the things that you had to learn about the pass application, reforming some relationships,
yeah,
especially those that probably you would want to contact to help you with your letters of recommendation,
yes,
right? Very key, especially contacting the school because you have to get a dean's letter.
yes,
And that's a requirement. Some programs do not or will not bypass that letter. So whether
yeah,
it's 1 year, 10 years, or
exactly.
15 years,
13 years. Yeah,
you gotta get that letter. But I
yeah,
think also part of the thing that's important about getting the application is making sure that you have documented your narrative and your story, right?
yeah,
Because
yeah,
that will be something that you will need to share as part of your personal statement, and also that will also be reflective in your CV as well. So
yeah.
all of
Exactly.
those things are related to your
So
application
true.
and preparing your application, right?
So true.
So
Exactly.
once you get your application, or even before you are putting together your application, you start having ideas, and some of those ideas can come from colleagues or mentors that say, hey, like in your case, hey, I've got 3 or 4 programs that you should definitely apply to. So let's talk about that process for you and other things that you did to come up with a list of programs and how you came up with that list that you felt fit you the best, in the best way. Meaning, why did you end up applying to these certain programs?
Right. So everything you said about keeping relationships and being ready with the CV and the personal statement, all 100% true. I think because I was still the same kind of person from dental school that I was, even though 13 years later, I was still doing volunteer work. I was still doing nonprofit work. Like I hadn't changed as a person, like, that, because that was my quote unquote narrative through dental school as well, was, oh, nonprofit, I want to give back when I'm a dentist. And that I was still doing that. And they were like, okay, we still see, oh, you actually opened a nonprofit. Oh, you're still the same person that you told us you were. I think that really helped them write me a strong dean's letter. Even though I had been out for 13 years, they could see, like you just said, from my CV and my personal statement, that I was the person that I told them I would be after I graduated. I didn't turn into, in my case, like an aesthetic cosmetic dentist only treating, VIP and the Upper West Side. Like I still do rural mission trips, and they're like, that's what she said she'd do. She's doing it. We can still vouch for her. She's still the same Tinashe from dental school. 100% on that one. And then now I've forgotten the question. What was your question?
Oh, we were saying the number of programs that you applied to,
Yes.
and why you picked those programs.
So I picked the programs. One, my mentors are biased. They're like, you will apply to the programs we went to because we still have good relationships and we will write you strong letters. So those two schools were in. Coincidentally, they were both on the East Coast. And for me and my family, right, because it's not just me going to orthodontic residency, it's me and my family. It's going to be quite a significant sacrifice to be away for 2 years. So my family had to be like a part of the decision about where I could go. So for example, West Coast was not an option. They're like, that's too many flights. We need a direct flight. So ultimately, when it came to location, it was locations that have a direct flight from Bermuda. So usually it's 2.5 hours to like the Miami area, New York area, Boston area, Atlanta, Georgia, Washington, DC. We had to be a direct flight under 3 hours, thinking of the 3 kids, thinking of my husband. And so after that, once we're like, okay, location, these are all the schools on the East Coast, direct flight. Which ones do I think would serve me well? So after that, I started looking at programs that offer early interceptive orthodontics. I wanted to really get good with functional appliances and appliances that you could use for kids that might have sleep-related breathing disorders. So schools that would have either an ENT program, oral surgery programs, or a pediatric dental program. I was like, they have to have at least one of those 3. If they have all 3, perfect. Because then I can hobnob and get to know them. Because just again, thinking in the future, Bermuda doesn't really have like orthodontic surgeons. Bermuda doesn't really have pediatric ENTs. But if I'm able to form those relationships whilst I'm in school, when it comes to time to refer or even have somebody come and locum from any of the specialists, I'll have personal relationships with providers who are already experts in their field. And I can make a call or consult. Again, just thinking to the future about the services that are needed here. Yeah, so we're quite intentional about the programs we were picking. I was like,
and that's cool. And that's cool that you approached it that way, but also it was real intentional because that's what you're looking for in a program.
Yeah.
Right. Because we get questions all the time as to, well, what program should I apply to? How many? And, the best advice is, well, let's back up first.
Yeah.
Let's back up based on what you're looking for in programs. And if you haven't gone through that exercise yet, you need to do that exercise as part. And as you're going through that exercise, you'll start looking at programs that you'll get some information from programs and you're like, oh, okay, yeah, that sounds good.
Yeah.
I'll put that down to do maybe a deeper dive.
Yeah.
But to your point, you were looking for something very specific based on what you want and how you envision yourself practicing in the next 20, 30 years, right?
Exactly.
And that was what sounded like from your answer that it's definitely going to be based off of interdisciplinary care and integration. Integration of oral health with medicine.
Exactly. I do not want to be a jack of all trades, master of none. I'm like, you're the master. I need you to master this for my patient, please. I'll figure out this part. You figure out this part.
Right.
Yeah.
So programs that have that approach or at least have that intersection
Yeah.
is key. So again, for those of you listening and watching, you need to determine what you're looking for first,
Yeah. You
and
have
that will
to.
help you come up with your list of programs
Yes.
and your why for those programs, right?
Exactly.
Location. For some people, people are looking for programs that pay
Yeah.
versus, pay a stipend versus a tuition or something
Right.
like that, right? Some
Yeah.
people are looking to get a master's in
Yeah.
ortho programs. So if you're looking for that because maybe you have some research ideas, or maybe you're
Yeah.
thinking about academia in the future, not that you need a master's to teach, but
Right.
some people want to have that additional credential to add
Exactly.
with the board certification as well. So many different reasons for picking certain programs, and reasons that will differ from applicant to applicant.
Exactly.
So thanks for sharing that with us. So again, what was the total number of programs you ended up starting off with on your final
11.
list?
I
11.
applied to 11 total, all on the East Coast. Yep.
Yep. Good. And there's about 50, 60 ortho programs.
Yes.
So 11 of those. So great.
Oh,
So,
I'm not gonna lie. Actually, I
oh, go
lied. I
ahead.
applied to one in the middle country. But I liked that program because their program director understands airway and dental sleep medicine. So again, just
Yes,
going back to
yes.
like really vetting the program directors and what their special interests were, and I'm interested in that part as well. So I was like, oh well, that's their part of the curriculum. I want that
Yep,
too. So I
yep.
did apply to their program. Yeah,
That's good. That's good. So 12, no, 12,
11
no.
still,
So
11.
11. One of
Yeah,
them just happened to be in the Midwest.
yeah,
So after 11 programs, you submit, everyone knows what you have to do then, which is wait. And some people unfortunately wait longer than others, but some people, depending on when you apply and submit your past application
yeah,
and any other documents, you should hear very early on, which
yeah,
could be as early as maybe August, maybe
yeah.
even September, especially with ortho being in phase one of the
Exactly.
match. So, and I think there might be one or two programs that are not part of the match, but I would say over 90% of all the ortho programs are in match, which means phase one, which means usually the Monday before Thanksgiving is when the results come out and when
Yeah,
candidates know if you've been accepted and where you're going to be going, right? But if
yeah,
you do a reverse engineer, you go back and you hit a couple dates, you've got interviews and you've got also application deadlines, usually
yeah,
August, no later probably than September. After
yeah.
your application deadlines, you're waiting for what? An interview. So let's talk about that. Let's talk about um, the interview day, number of interviews that you received, what the interview day was like, maybe some strange or
Oh
different
yeah.
questions that you didn't expect. Tell us a little bit about that as well.
So I'd say I probably was more of I definitely wasn't late. I think I had everything in by July, the latest, because again, I knew I was very non-traditional. I didn't want to fall beneath the cracks of because the competition's stiff, let's just be honest. so so I applied not early, not the first week, but definitely within the first month. So like by July, all my information was in. And that's when there was the round of secondary applications. So I'm glad I had my first, like early July, everything was in because the secondaries were being requested for. And I think I had all of those back to the programs that wanted secondary information, definitely by August. Because by August, I know I had to travel, everything was in. And so, yes, the waiting game. So I actually reached a point where I was like, okay, I'm not getting an interview because slowly the rejections are coming in first. The rejections came in before any interview offers. And so in my mind, I'm like, okay. And again, remember when I applied, it was kind of like, I'm doing this for my mentor. I didn't really have my heart set on it. I was trying to protect my heart. I didn't want to be too disappointed. So I was acting hard, like, okay, well, rejections. I'm not surprised. That's how I was behaving, even though I was like, oh, please. But exterior, I was like, yeah, I'm not surprised. I'm old. I'm really non-traditional. I didn't have like the ADAT. Yeah, okay. Making excuses for the slowly trickling in rejections with really nice emails like, sorry, but you're not the candidate we're looking for,
And that's fine. And that's fine. That
That's
is
fine.
also part of the process. You are supposed to get rejections just like you're supposed to get acceptances or invitations. It's part of the
Exactly.
process.
Part of the process. So I was like, it's okay. My family was still like, it's okay, we still love you. We still love you. I still have my team of 5. My family is still cheering me on. Here's another rejection. Let's go for dinner. At least mommy tried. And I believe the day I got an interview request, I had actually been with the orthodontist. And for her, she was also now starting to get a little, discouraged too. She's like, okay, well, it's okay. We can try next year. Literally the same day. She said that to me in the morning. She's like, okay, well, there's next year. You can try next year, because now it's like end of October.
Yeah.
It's like November, knock, knock. We're like, okay, it's dying down. I think the interviews end next week. Like, it was one of those. So she's like, it's okay. I think you're still a great candidate. We'll just reapply next year. We'll change strategy. She's like, we'll just change the strategy. I'm like, yeah, that's fine. And in my mind, that's what we were going to do. I had accepted it. We're done. And as I'm walking somewhere in town, my phone pings and I'm like, oh, what's this message? Interview. You've been invited to.
Yeah. The Ortho Tooth Fairy was contacting you, right?
I go running back to her office and she's with a patient. I'm like, I don't care. I like have the phone and I like waving it in her face. I got an interview. And she's just like nodding, she's in the patient's mouth, like bending a wire. I'm like, oh. And of course, like I reply immediately. I'm like, I don't care. Like, you want me to fly tomorrow? I'll fly tomorrow. I will cancel all my patients. Like, what do you want? What do you want? It ended up being virtual. Yeah.
Right.
And it
So
was
you had a virtual interview and you had one virtual interview?
One interview.
Yeah.
And it was virtual, which I'm not going to lie, I was disappointed about because, virtual, anything can go wrong. Internet, Wi-Fi, there's the Bermuda Triangle. I don't want my Wi-Fi to cut out,
Right.
I was like, seriously, I'll fly to you. Like, because again, we potentially picked East Coast direct. I'm like, it's 2.5 hours. I will fly in the night before. Like, I will come. I even asked them, I was like, no, please, may I come? I wanted it to be in person, but they insisted. They're like, no. And so I'm not going to lie, that did discourage me a little bit. I was like, oh no, they've probably already selected. They're probably just giving me the interview just to honor me or to honor my mentors. My mentors are amazing. They're probably doing it to honor them. I was still discouraged. Even I had the interview, I was discouraged because it was virtual.
So you had this virtual interview, and what were some of the questions they asked, or ones that were like, oh man, they got me on this one, or that you had to really think of, think hard, not too long, but hard to answer? Were there any tricky questions?
But you know what's funny? None of the questions were tricky. What actually ended up happening was all those things I told you about. My internet glitched. They couldn't hear me. I could barely hear them. I had to ask them to repeat their questions. Oh yeah, the interview. Yeah, I did. You see how it's easy to communicate? Like, you can hear me, I can hear you. It sounds like a dialogue. My internet was choppy that day. Oh my goodness. I was like, no. Everything that I didn't want to happen is kind of happening in this interview. So I managed to get through the questions. They somehow managed to hear me. I somehow managed to hear them, but I had to like put my head to like the speakers to hear their questions. But we got through. I'm not too sure if it was painful for them as it was painful for me. I was apologizing profusely because it was just really hard to hear each other. The interview was choppy, but I was able to answer the questions as authentically as I could. And again, thankfully, I think they all had read my personal statement and had gone through my CV. So the questions per se, none of the questions were tricky. Nothing threw me off. But what did throw me off was not being able to hear
Yeah, the internet,
the
and
internet that I had like, yeah.
yeah,
So we
yeah,
got through it. And I stayed on at the end because there was someone who brought us on and took us off. And I stayed on at the end to actually apologize because I was like, I don't know if it was mine or, but and I followed up. I followed up with an email. So that was another thing, recovery, like how to recover from that. And I don't know if it impacted my ability to match or not, but I followed up literally the next day with an
yeah,
email, just rewording my answers or saying my answers because I was like, I don't know if they heard anything, and restated my answers from the questions that I remembered, just apologizing for the poor quality and just letting them know I still want to come to your program,
yeah.
despite our very awkward interview.
Despite the technical difficulties we were
Despite the
having with those
technical
questions that you
difficulties.
were asking, what kind of questions did they ask? If you
Why
remember,
our program?
why our
Same question that
program?
you asked, like, how did you choose this program? How did you choose the programs you applied to? Why ortho? Why ortho now? And in my case, I had shared about my family in my personal statement, so that pretty much allowed them to ask like what role my family would play. And my family has been like my main supporter throughout the whole thing. So I discussed my family, my upbringing, how or why ortho, why now. It was pretty much those questions, and then experiences, how I got exposure, and just things I had done. But really, we spoke a lot about how I was a match to their program. Again, not knowing how much they heard, but I did follow up with an email the next day where thankfully, during the interview, I was able to get the names of each of the faculty, the attendings. I wrote them down and I sent them each an email. They got
A
an
thank you, a thank
thank you
you.
email, and sorry for the technical difficulties.
Yep,
Here's a quick
yep,
summary about the answers I gave in case you didn't
yep.
hear me. I would still
Great
love to
tip.
work with you. Yeah,
That's a
and I
great
did
tip.
research on each of the faculty as well. And I was like, okay, this is where we match. Like one person really loves biomechanics and I really want to be strong in that. I was like, I look forward to learning biomechanics from you because I really have to get strong with my wire bending and the forces. I
Yeah.
want to be really good at that. Another one was very strong on functional appliances. I was like, okay, well, I look forward to learning more about functional appliances.
I wonder who taught you all this ways to follow up, because as you all
Yeah,
are listening and hearing, the fortune is in the follow-up. Yes,
I mean, I
follow up.
had to.
Yeah, in this case, right. You were
I had
forced
to.
to,
I had to
but
follow
it's
up.
important.
I did not have a choice. A simple thank
Mm,
you was not going to be enough in my case. In my
yeah.
mind, I was done. So I walked away from the interview. I cried, I sobbed, and I told my husband, well, I've tanked it. Tomorrow, when I've recovered a little bit, I'll still email them because they did make the time to interview me. I am still grateful for the opportunity. Like I interviewed, like that to me was amazing. I was like, I
Yep.
interviewed like that. I was like, that amazing.
So in this case, everyone listening and watching, it doesn't happen all the time, but when it does happen, it it's the next step, which is you only need one interview. Even with technical difficulties,
And I wanted to play.
due to a
I wanted to
virtual.
go out there.
Yeah, yeah. And we'll talk about that too a little bit later. You only need one, right? Especially one that you want and they want you. And again, it goes back to the questions that come from the interview. They come from where? Your application.
Yeah.
You mentioned something that I wanted to touch upon, which is your personal statement, and that there were a lot of items that you mentioned in your narrative and your personal statement that was context for them to ask questions in
Yeah.
that interview, right?
Yeah.
So again, this is why it's so important that this at the application phase and those two documents, your CV and your personal statement,
Yeah.
have to be spot on. That gives a narrative, gives a story, it gives a good context as to who you are, what you're
Yeah.
about,
Who are you?
why
Exactly.
ortho, and some unique things
Mhm.
about you. You right?
Yeah.
Because at the end of the day, yes, programs are picking residents, but the residents are who? People. They're picking
Yeah.
people. right? They're picking people. So
Yeah.
I'm glad you mentioned that some of the questions actually came from
Yeah.
things that you had shared in your personal statement, and it's their opportunity to get to know you a little bit more
Exactly.
virtually, in person via Zoom, So that's
Exactly.
great. That's great. So the people that got to know you ended up putting you down and listing you as one of their what, five? Yeah, five or four. Six.
I think this one is 6. Yeah, this program has.
Six. One of 6 residents, future residents that they wanted. So now we're going to talk about the program that you're going to be going to. You're going to be leaving Bermuda to go to this program. And we're also going to talk a little bit about things that you really like about the program, that you're really excited about when you're going to be joining them in about less than 30 days. So
Yeah.
now it's time for the program reveal. Where will you be taking your experiences to train as a future board certified orthodontist?
Here it goes. Da, 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 da. Da, 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 da.
Howard University, for those of you that are listening, she just put up a sign that said HU Howard University.
You know?
Washington, D.C.
I haven't even been there, but I know you say that.
Yes.
I'm excited. Yep.
Yeah, you should be excited. This is an exciting time, right? Full circle, exciting time. So HU, Howard University, they take about 5 or 6,
I believe it's
5 or 6 residents each year. It's a 2-year program.
Yes.
Let's talk a little bit more about the program. What about the program do you just love based on the research you did, based on the interaction that you had with faculty members doing the interview? What are some of the things that you really love about this program?
I mean, so like you said, right, it's a match. And I really like what you say about just be your authentic self in the personal statement, because if you lie, a program will think you're a lie that you've presented in the personal statement, and that's who they're going to expect you to be. I was so transparent and raw in my personal statement, maybe a little too transparent, but I've also reached that point in my life, I'm old, where I just like, this is me. If you don't want it, that's fine. But if you do take it, I've presented my authentic self. This is me. I come with 3 kids and a husband. I have a practice. I really want to learn about kids. And Howard was a match for all of that. So Howard goes back. I applied to Howard for undergrad, like dental school. Got accepted, but at the time I was broke. So I ended up chasing the school that offered me the best financial package, because that's all I had. Versus now, Howard doesn't really pay. It's more, I'll be paying, but I'm in a position to. I've been working for 13 years. I have savings. I can afford to pay for the program myself. So that was never an issue. But I love the program director. Dr. Marshall has been amazing the whole time. I'm like, she's approachable. She's easy to talk to. But her advocacy work, she cares about her residents. She cares about her community. The work she's done just in the DC area to transform lives beyond just orthodontics. And she's still in touch with Dr. Tuzo, who's all the way in Bermuda. So that spoke volumes to me. I'm like, she keeps in touch with even alumni from back in the day internationally. That to me was important. It's not like I left and you've forgotten about me. And even the feedback from the residents, because I know a couple of the residents, some who've just graduated and some from before. And that's one thing they all kept saying, program director loves us. And that's important, because I did attend a residency before where I did have a lot of love from the program directors. That was Bronx, Lebanon. And there's nothing you can replace to mentors who want the best for you. So I wanted to be in a program where I know, especially when you're struggling, if there's a course you might be struggling with, that the professors, the faculty, the program directors want you to succeed. That'll make or break you. That's the kind of thing that'll either keep you in a residency or get you kicked out. So I was like, no, will they want me to succeed? I want to be in a program where they want me to succeed. And that's all I've gotten from, Dr. Marshall's, that she wants each and every one of us to succeed. So I was like, yeah, that's my woman. It's not going to be, oh, you're struggling, let's get rid of you. No.
And that speaks volumes to the program, but also to the individual that's in charge of and making
Yeah.
sure that that curriculum and that culture
Thank
is
you. The
continued to
culture.
be cultivated such that people want to be there and, you
Exactly.
know, they're able to succeed in individually, but also as a group. So
As a
shout
group.
out to Dr. Marshall
Yes.
at HU, and also shout out to all those other programs and individuals that have kind of helped you determine
Yeah.
the things that you're looking for and the things that you're excited about.
Yeah.
So shout out also to Bronx Care up in
Yes.
New York as well.
Yeah.
What you mentioned the advocacy work and how the program has built community within the community, right?
Yeah.
What are some of the other things, strengths of the program that you're excited about?
So they have a pediatric residency program. So I will be sneaking into their classes.
Yep, some pedo, ortho, and
Pedo,
there's
ortho,
always, and they have oral surgery
they
too.
have oral surgery. So you see,
They
I'm
do.
like, yes.
Yeah. So as an
Yeah.
ortho resident, there are some coda standard curriculum requirements related to orthodontic surgery.
Exactly.
So
And
you'll
I
be
will be
working
in
with
there. I'm
those.
going to
Yep.
volunteer myself if we ever have breaks, again, without understanding how it's going to work with classes. But if there's ever an opportunity to go and like work with the orthodontic surgeons, I will be there sucking in the OR. Because I
Yeah.
want to understand that stuff because I'm coming back to an island that doesn't have an
Right.
orthodontic surgeon. So I want to
Right.
get really tight with my surgeons and my pediatric dentists and
Yeah.
have, like you said, a
That's key.
multidisciplinary core,
That
my team.
interdisciplinary. Yeah,
Yeah.
that's key. What other things should people know about strengths of the program from your perspective and why you're so excited about going and being trained by Howard?
So it's in DC. I do a lot of nonprofit work. So again, when it goes to advocacy, meeting with officials, getting involved with politicians, pretty much decision makers. I'm quite comfortable with decision makers. You know, I sometimes consider myself a disruptor, but only for the greater good, right? You don't just disrupt for the sake of disrupting, you disrupt for the greater good. So I'm very, very interested in policy. I want to learn how they do it in DC to have like long lasting changes and bring some of those ideas back, maybe bring back some of those strategies back. And not only like in Bermuda, but also Zimbabwe, you know, where I was born and raised. I want to be able to use some of those strategies for advocacy. How do you speak to people? How do you present to people? How to even build those relationships? How do you communicate efficiently? How do you use their language so that it can actually show up to the patients who are coming every day for care? You know, so I really do want to get into that a little bit as well.
That's good. That's good. Now,
Obviously,
again,
yeah.
Also part of the overview for Howard, you mentioned tuition, and so how much is tuition for the 2 years or for
So the
each year?
tuition each year is 45.
45. Okay.
That doesn't include housing.
Yep. Yep. And program is how long? 2 or 3 years?
Years. Yeah.
Two
And that's what
years.
I was looking for as well. I was like, I could do a 3 year. I would prefer a two because I
Right.
have a family. Yeah.
And is there a master's that's associated with it?
Yes, there is.
Yes.
And I love to teach.
So there you go. Master's, 2 years, tuition 45.
Yep.
Strengths of the program are related to really are centered around one key figure, which is Dr. Marshall, the program director.
Gosh.
But also for you, centers around being able to intersect with other disciplines.
Yes, I have
especially in the area of
to.
interest, which is airway, sleep management,
Class
malocclusion,
three.
class
Yeah.
threes, and then also how to being in DC gives you the opportunity to learn and also interact and hopefully collaborate with
Yeah.
decision makers around policy to
Yep.
move the needle forward, right? So
Yep. Got to.
all great reasons and highlights for Howard's program. And again, congratulations. We got another one coming to Howard. That's great. That's great. So
Finally.
we want to say thank you for all the people that have been listening so far, because now you've got to another section of the episode that people really love. They love to get advice. They love to hear
Yeah.
tips. So knowing what you know, now that you've gone through this process,
Yeah.
what advice do you have for future applicants, or actually applicants and individuals that are applying right now as they
Yeah.
are listening and watching? What are some tips? Give us 4 or 5 tips if you
4
have
or
that
5
many.
tips. Gosh.
That applicants must do
Must
and
do.
must do when applying to ortho.
Have the right mentors. And when I say the right mentors, it doesn't even necessarily have to be like, oh, this is the published mentor who's in like the New English Journal of Medicine. This has to be the mentor who will write you the strongest letter, who will give you the highest recommendation, and who will support you, not diminish you and make you not believe in yourself. This will be the one who will be pushing you to believe in yourself, to be the best version of yourself, and to present you so well that the other side wants to meet you. Those kind of mentors, don't, because a lot of people will be like, oh, I want the name brand. But if the name brand isn't going to back you and they're going to sound average in their personal statements, they can tell. Remember, those admissions committees are reading hundreds, if not thousands of letters. They can tell a letter that's got passion and drive and like authenticity versus, oh, okay, this was copy and paste. They can tell. And then the other thing I'd say is submit your stuff early, especially if you're concerned that you might be an average or a non-traditional applicant. It's better to be early so that they are looking at your application early, fresh. It's early in the game. They're not so worn down by all the other amazing applicants.
Now, when you say early, people may not fully understand what early means. So when you say early, what do you mean by early?
The first 4 weeks. So I think they open like May 15th, May 23rd or something.
Yeah, the
first 4
DFAS
weeks.
application opens up at that time, and that's
that
when you can
first 4
start to
weeks.
input.
Yep. And make sure everything's ready to go, right? Copy and paste, download. Make sure you have all like your what do they ask for? The records, the official transcripts, all of that has to be ready, which pretty much means January, February.
Ooh,
like, okay,
did y'all hear that? Did y'all hear that? January, February, start getting the documents that you need to submit and upload into DFAS, which doesn't open up until May, but still having it ready so that when it's opened up, it's already been submitted.
Takes time. Yeah, it takes time because you have to reach out. And also depends how many programs you're applying to. But each program might have like their own criteria that they want, and you have to do that. Then you have to pay money. So I say do it early, that first 4 weeks, because after that 4-week window, they're getting flooded. And then you're just going to be another number and it's going to get tight.
Yeah. And when you say they're getting flooded, you're talking more about the schools and those individuals.
Everybody's now submitting. Yeah.
Everyone, all the potential letters of recommendations that are coming from recommenders. They're getting solicited from other candidates to do the same thing. So that's early is good. So that's 2 tips. Anything else?
Oh gosh.
What else should candidates?
Did I talk about the personal statement? I think I touched on it a little bit, but only because before I applied this time, I used to help other students with their personal statements. And one thing I found was people would follow like a template, which is fine, but make the body you. Like, be your authentic self. Sometimes people feel pressure to maybe embellish on things that they're not even really interested in just to tick a box. I'm like, no, but it's not you. Be you and present it as the best version of yourself, so just be authentic. Of course, get a proofread, make sure it sounds like you, like the best version of you, and then put it out there. You want to match in a program that wants you. You don't want to match in a program and then be miserable because they're expecting you, like I was saying earlier, to be XYZ and you're presenting as CDE.
Yeah, that's key. And that's some things that we teach in our training with regards to a personal statement, making sure that you're telling a story, you're sharing some unique characteristics that are only unique to you. Because why? Because the programs have to get to know you as a person, or you have to have some content in there so that they want to know more, which means invite you to an interview. Right? Who is this person? I want to learn more about it. And And you're right, you're spot on by being authentic. Very,
Yeah.
very important. Very, very important. So you said start early, have the right mentors that are going to support you, and be authentic in your personal statement. Anything else that you can think of?
Support system. For me, it was my family. Obviously, they're going through this with me. They
Right.
saw me practicing for interviews. I had a cohort of 5 girlfriends. I managed to find like 20 questions from the web and just like researching questions. What questions could they ask? And then I like was trying to guess, okay, which faculty from the ortho department might they pick? And so I labeled them. I'm like, okay, you pretend to be Dr. Marshall. She's into advocacy, so only ask me advocacy questions. So each friend had a set of questions that they had a personality, and I'd sent them a bio from the HU website, bios of each of the potential faculty that might interview me. And I was like, just pretend to be them and ask me these 5 questions that they might ask me.
Yeah.
And so I role played with my friends. Of course, the internet was amazing when I role played with my cohort of 5. So I was like, yeah, I'm ready. But again, just support system, have your close friends, people who ride or die with you, who'll cry with you. I was really disappointed. I put on our WhatsApp, my interview tanked, but they still supported me. And they were the ones who were even like, send an email, put this in the email, don't put this in the email. Cohort of friends. And a couple of months later, I was telling them I'm going.
Yeah, exactly. It's
Yep.
it's a process, and it takes a village, right?
It really does.
It takes
Yeah.
a village, whether it's girlfriends, guy friends, classmates,
Yeah.
coaches, whoever, getting
Yeah.
that help, and people that are part of your support system. And
Yeah.
if you're looking for a support system and you need some accountability or want to have some accountability, and practicing
Yeah.
probably the most important part of this whole process, which is being authentic in person, or in your case, virtually, during the interview, right? Getting some help and doing what we call mock interviews, because yes, you do need to practice, right?
Yeah.
Practice does not make perfect, but it makes you
It helps.
perform better.
That helps. It helps with
Yeah.
the technical difficulties.
It does. It does. And things that may come up as you are sharing your narrative, as you are sharing why, and as you are doing the number one job that you must do, which is give them every reason why they must select you in that interview. That's your job. So to get some help with that, check out again, get into dentalresidency.com, where we actually have a training program helping you prepare for the mock interview. And whether it's 1 interview, 2, 3, 4, it helps. So some great tips, Doc. 4 great tips to hang our hat on, and so that people can use that are applying right now. What's the best way for people to get in contact with you if they have any questions?
Yeah, so you just email me my Gmail, Tina2chaps, that's TINA, the number 2, CHAP, like chapsticks, @gmail.com.
Where's it at? Right up there. Check that out right up top.
Yep.
Get in contact with Dr. And but you got to be quick, because she's getting ready to move. She's getting ready to transition. She's getting ready to start ortho. She's getting ready to start reading all this profit book, which I got a quick tip for you.
I have it.
Yeah, I would say if you don't have it, you better dust it off quick, because a couple former residents of mine that did ortho at Howard, they say they spent the summer doing what? Reading Profit. Yeah, that book right there, right? The Bible of orthodontics.
And it's a great read too. Like it makes sense.
Well, at this point, it's no choice for it to be a great read,
I know.
because it is the read.
It is.
It is the read. So you can contact Doc there. Just real quick before we finish up, what are your future plans after these 2 years that are coming up? And I know you won't believe it, but the 2 years are probably going to go by very fast.
Yeah.
What are your plans after residency?
I mean, I have so many plans for residency. I'm just like, I'm going to do research. I'm going to network. I am going to do surgery. But after, definitely coming back to Bermuda, and now the orthodontist in Zimbabwe is like, well, you have to come back here. So we're already discussing what we can do. We want to do some work in Senegal and Zambia and South Africa. Significant needs there. So we're going to try to figure out how to work that in. But Bermuda is going to be the first stop. We love Bermuda. I love my mentor here. I almost feel like I owe her. I owe her, just for believing in me. I can't even tell you what the level of support she gave me and just belief in me. She believed in me more than I believed in myself, really, if I'm going to be honest. So I'm coming back to Bermuda for her. I owe her. I'm going to come back here. And she tells me jump twice, I'll jump 3. I'm coming back for this amazing mentor that I have here. So Bermuda will be our first stop, and then Zimbabwe and Senegal up next.
That's good. And I'm sure the way that she's going to really appreciate you coming back is by also playing it forward or pushing it forward.
Oh yeah,
right?
I will pay it to her 5 million ways if I can.
That's right. And that means helping the future orthodontists that are listening and watching right now, but also making those positive contributions into the body of knowledge of orthodontics. For all the enthusiasts, but also for all of those people that are doing research to improve outcomes, right?
Yeah.
That's how you also make your contribution and play it forward for mentors like yours and the mentor that you're going to be very soon.
I look forward to it. Yeah, we have to get this done, guys. We have to.
Yeah. Well, we're done here, guys. Thanks for listening. We got one more thing for you to do, though. Go to the next video. Go to the next video right now. Hurry up. Go. Next assignment is go to the next video. Go to the next video right now. Go. Love, peace, and smiles. Go to the next video. Go to the next video.